Good morning, everyone. I see so far that Alan, Ariel, Rachel are on. I'll give a little more time for others to join before we get started. Have any other board members joined? All I see is Alan, Rachel, Ariel, and myself.
I don't see any yet.
Okay, thanks.
I have been checking the attendees to see if I notice any that I can move up to panelists, but I know that Tracy White is working on getting on for sure.
Okay.
And Gary has contacted the other members too.
Thank you for the feedback. I appreciate it. We'll give them a little more time.
Okay.
Dr. Dadam will be joining momentarily.
Stephanie, there are now 5 members of the board present.
Thank you very much. This hearing of the New Mexico Department of Health Medical Cannabis Advisory Board will now come to order. I would like to welcome you to the public hearing where the Medical Cannabis Advisory Board will receive updates from the medical cannabis program, discuss petition 2022-001, hear comments from the public, and discuss the schedule of a fall 2022 meeting. Pursuant to notice, this matter is being heard this 22nd day of March 2022 via a WebEx event platform and is being recorded. The time is 9:12 and I am Stephanie Richmond, the chairperson for the Medical Cannabis Advisory Board. New Mexico Department of Health Assistant General Counsel Chris Woodward will be advising the department during the proceeding. This proceeding is being held in accordance with the Lynn and Aaron Compassionate Use Act, Sections 26-2B-1 through 26-2B-7 NMSA 1978, and regulations at NMAC Title 7, Chapter 34, Part 2. If members of the audience have not already registered for this event, please register online so that your attendance may be noted and included with the advisory board submissions to the Secretary of Health. At this time, I'd like to introduce each Medical Cannabis Advisory Board member and take roll call in alphabetical order. After my introduction, please announce your training, specialty, and interest in the Medical Cannabis Advisory Board. Ariel Bowers.
Good morning, I'm here. I'm a psychiatric nurse practitioner and nurse midwife. I work in Albuquerque, New Mexico, both in private psychiatry practice and then also as a nurse midwife in a hospital system. And I have a background in addiction medicine and also do a lot of work treating trauma, and have found that many of my patients with a history of PTSD and with diagnoses of PTSD have benefited greatly from medical cannabis. And I am interested in supporting my patients and supporting our community. And so that's why I'm here.
Thank you. I did not see Mordecai Bronner, is that correct? Next is JP Dadam.
Good morning, everybody. Sorry I kept you waiting. For some reason I had it, and the invite I got said I glanced at it, it said 11 a.m., but I think it must have been 11 a.m. Eastern Standard Time, and I got it in my head that the meeting was until then. Anyways, that's my fault. I apologize. I am a family medicine doctor by training. I practice here in Albuquerque as a hospitalist, but I also run the symptoms management clinic for the New Mexico Cancer Center, where I do manage their medical cannabis patients, and can say from personal experience in working with those patients, they derive great benefit from medical cannabis. Thank you.
Thank you. Next is Rachel Goodman.
Hi, I'm Rachel Goodman. I'm an OBGYN physician here in Santa Fe. I work at Christus, and I've been on the board here for, I think, maybe almost 6 years now. So I've really enjoyed learning about medical cannabis. I know there's not always a ton of content related to my specialty specifically, but I'm always happy to be here to answer any OBGYN questions and contribute, and very passionate about this topic. So I'm glad to be here.
Thank you. Nice to see you. Next is Alan Plymall.
And have quite a few patients who have a broad spectrum of problems that would benefit from cannabis use. And so I'm happy to be here and try to be helpful. Thank you.
Thank you, Alan. My name's Stephanie Richmond. I'm a physician assistant in primary care at an outpatient clinic at the University of New Mexico. I concur with a lot of the comments made by the rest of the board members. I have seen how beneficial the medical cannabis can be for patients, and being able to help assist them have access to it in a different way from working on this board has been very rewarding to try and help patients outside of in the exam room. I didn't see Mordecai, Courtney, Davin, or Tracy, but we do have.
Mordecai just told me he's not going to be able to make it.
Oh, sure. Thank you for that feedback. And then I also understand that, Alan, I think you might have been, the audio might have been connecting when you very first started to introduce yourself. If you could just introduce yourself for the record again, that would be helpful for clarity of our record here today.
Okay, having a little trouble getting it switched on. Alan Plymale, I'm a clinician at Members Internal Medicine in Deming. And again, have a broad spectrum of patients with all kinds of needs. Many conditions fit the protocols for cannabis, and happy to be coming help to some of those people for use and moving it forward. Thank
you for round two, Alan. I appreciate it. No new appointments were made to the board since our last meeting. I motion to approve the minutes of our last meeting that was on December 7, 2021, as this meeting was recorded and may be viewed on the Medical Cannabis Program webpage. Is there a second for the approval of these minutes?
Stephanie, I want to let you know that Tracy has joined by phone, and we're going to try to unmute her so she can also introduce herself.
Oh, great. Thank you.
Libby, she's calling user 8.
Hi, good morning, it's Tracy. Can you all hear me?
Yes.
Okay, awesome. Sorry about that. This is Tracy White. I'm a clinical pharmacy specialist in Las Cruces. Work in oncology and palliative care. So I work with patients on symptom management, and from a pharmacist perspective, of course, interested in drug interactions, drug disease interactions, those kind of things. Thank you all.
Thank you, Tracy. Also, please let the record know that there are now 6 of 9 advisory board members present, and therefore have established quorum. I appreciate all of the board members being able to participate in the meeting. Thank you. I had motioned to approve the minutes of our last meeting on December 7, as this meeting can be recorded, or was recorded, and is able to be viewed on the Medical Cannabis Program website. Is there a second for the approval of these minutes?
I'll second.
Thank you. Additionally, the proposed amendments to some of the rules and that we had approved at our last meeting have been published online and became effective on February 22nd, 2022. And we'll be hearing more about this from the Medical Cannabis Program. So at this time, I would like to invite the members of the Medical Cannabis Program to update us regarding their activity and progress. We'll be hearing about the updates to the adequate supply limit, streamlining unit increases, and the elimination of background checks. Thank you. You may proceed.
Thank you, Stephanie. This is Dr. Dominic Zerlo, the Director for the Medical Cannabis Program Division. And let me go ahead and share. Oh, Libby, I'm not able to share my content. We'll get that here in just a moment. In the meantime, before the presentation itself goes up, while we're working on that, with regard to the new regulations, as you mentioned, Stephanie, they did indeed promulgate on February 22nd. And what they have done is, as you all also approved and recommended, is it increased the adequate supply limit to 15 ounces or 425 units per patient and reciprocal participants within each 90-day period. And so that has now gone into effect, and that has been working well so far. The streamlining of the unit increases really should be the elimination of the unit increase letter requirement. So now all patients and all participants are actually at that same 15-ounce, 425 unit limit and do not need to go to their providers in order to get a unit increase letter. And so that has also been beneficial because it has helped reduce the burden on the patient to actually have to go through that process of being able to obtain additional cannabis. And so in this case, that has also reduced the burden for them. Also the cost, because as we know, those unit increase letters did come at a cost through many of the providers that were offering them. And so we see that as a benefit for the patients. And the patients that we have spoken with so far have actually been very happy that they do not have to go through that process. And then the third major item with regard to those regulation change was the elimination of the background check for the caregivers. And part of the reason this was important is because it helped our regulations to align more completely with regard to the new Cannabis Regulation Act with regard to the actual charges that could actually be brought against individuals who had cannabis. And so this eliminated that because we wanted to ensure that individuals were not being harmed or have adverse reactions due to previous or past behaviors and arrests that are no longer valid under the new CRA, Cannabis Regulation Act. And so that's essentially the updates with regard to the regulation. And now it does look like I can share my content. So let me see if I can do this. Libby, it's actually only letting me do this as a whiteboard or a file. I'm not sure what's happening on that. We were able to share just the other day. So my apologies, everyone. We'll see if we can get that moving forward. In the meantime, I'll explain some of the updates, and we will have the PowerPoint posted up onto the website. And so it will be available for individuals, and I'll continue to check as we work on that technical issue to see if we can't get it for the screen to be able to view it. But in the meantime, before I start on the rest of the PowerPoint, I just want to offer on behalf of all of our colleagues at the Department of Health, we humbly acknowledge that we are on the unceded ancestral lands of the original peoples of the Apache, Navajo, and Pueblo, both past and present. And with gratitude, we pay our respects to the land, the people, and the communities that have continued to contribute to what is today known as the state of New Mexico.
Try now and see if it works.
Thank
Sorry
you,
about
Libby.
that.
Nope, that's okay. Perfect. I think there we go. Can people now
We can see it.
see it? Okay, great. And so the mission for the Department of Health is to ensure health equity, and we work with our partners to promote health and well-being while improving health outcomes for all people in New Mexico. This includes working towards expanding equitable access for services, helping to improve health status, ensuring safety in New Mexico healthcare environments, and also by supporting each other by promoting an environment of mutual respect, trust, open communication, and the needed resources for the staff at the Department of Health to be able to serve New Mexicans, especially in these other goals, and to grow and reach their own professional goals. For the medical cannabis program specifically, we operate with regard to the Lynn and Aaron Compassionate Use Act, which has the purpose of allowing beneficial use of medical cannabis in a regulated system for alleviating symptoms caused by debilitating medical conditions and their medical treatments. New Mexico has medical cannabis patients in every county within New Mexico. As of the end of February of this year, there were just under 132,000 patients who were enrolled in the program. As you can see on this map, and for those who are on the phone, my apologies that you may not be able to see the map, but it illustrates that there are patients in every single county within New Mexico. The three highest counties with patient enrollments are Bernalillo, Santa Fe, and Doña Ana, which is not unsurprising because those are the three highest population centers in the state. There also are 669 out-of-state enrollments. These were individuals who were enrolled during the brief period in 2019 when out-of-state enrollments were legal in New Mexico. They are not currently legal for out-of-state individuals to enroll in the program. However, they can participate as reciprocal participants if they are enrolled in a medical cannabis program in their home jurisdiction. Our patient enrollment continues to increase. The graph that I'm showing now illustrates how much the patient population has grown within New Mexico since 2018. In 2018, there were just under 49,000 patients enrolled in the program. And now in 2022, there are just under 132,000 patients enrolled. This is an increase of 83,000 individuals in active enrollment from 2018 to 2022. The three most commonly enrolled qualifying conditions are post-traumatic stress disorder with a current enrollment of 72,000 individuals, severe chronic pain with just under 40,000 individuals, and cancer at 6,600 individuals. In addition, this slide also shows how that has increased over the past 5 years since 2018. And again, for those who are on the phone, just to give an idea, for post-traumatic stress, there were 23,800 individuals enrolled in 2018, and now there are 72,000, just over 72,000 individuals enrolled in 2022. All the numbers that are on this particular slide are February to February in each year and illustrate how much the program has increased in the patient load. An interesting thing that we do see on this particular graph is that while the patient load has increased, the percentage of individuals enrolled for each position, while it has varied somewhat, has actually stayed fairly stable. The biggest change really has been within post-traumatic stress disorder. In 2018, it accounted for 48.75% of the patient enrollment, and in 2022, accounted for 54.58% of the patient enrollment. There was also a request for a little bit more with regard to ethnicity and some other demographics. And so what we have provided, and one thing to recognize is that on our enrollment application, the questions about demographics are optional. So not all individuals necessarily answer it. So there is a different number to the responses on this. But you can see that at this current time, we have had just under 84,500 responses with regard to race and ethnicity. And with that, 41,000, just under 42,000 individuals had indicated as Caucasian, and 35,000 individuals indicated as Hispanic. Another important thing to recognize here is these are not necessarily exclusive. For example, someone may choose Hispanic and also choose another ethnicity as well. For gender, you can see that we are tracking different gender responses from individuals, and it is actually very even between male and female. For female, we are showing 50,678 individuals who responded, and for male, 50,332 individuals who indicated that they self-determine as male or female. And so with this really helps us to show and for us to be able to track and see how individuals are being represented within the program. And one of the areas that the program is working on is to ensure that individuals who do not necessarily identify as either male or female, but as non-binary and other gender designations, feel more comfortable with being able to report that, so that we can actually be able to track and see, is this a population where we need to focus some more energy and effort in trying to reach and ensure that they're receiving equitable services. Age ranges among the patients in the program. This particular graph shows their age ranges in 10-year blocks, with the exception of 20 and under. So that 20-year block is showing we have currently 2,680 individuals who are enrolled in the program at the age 20 or under. And then again, for the purpose of the people who are on the phone, 21 to 30, we have just under 20,000 people enrolled. 31 to 40, there's just over 26,000 people enrolled. 41 to 50, just over 21,000 individuals enrolled. 51 to 60, just over 21,000 individuals enrolled. 61 to 70, about 24,700 individuals enrolled. And for age 70 and over, we have 16,593 individuals enrolled. And so this really helps to show the age range of the patients that are in the program. From a program perspective, we think this is very important, because one of the criticisms that we hear in media and in other places is that the majority of people who are enrolling in the program are younger and who are just experimenting with substance use. And this particular slide actually denies that. It actually shows that we have individuals of all ages who are truly treating their medical conditions. And so we really are very glad to be able to see this and show this, because it really does show that individuals who are enrolled in the program span all ages of New Mexicans. And then I just wanted to invite Dr. Gary French on for a moment to just discuss a little bit about our online patient portal. He did a longer presentation during the last Medical Advisory Board meeting, and we just wanted to provide a brief update. Gary?
Yeah, currently approximately 30% of our applications are coming in electronically. And this is a goal that we had set for this first year utilizing the portal, and I'm glad that we've reached it. And it does seem to actually be facilitating patients as well, accessing their unit history so they can see where they've made purchases and how many purchases they can still make. And I think going forward with the upcoming recreational sales as well, this will be really important for a feature for the patients to utilize. And I do think the portal has helped engender this. Now, with regards to the online applications, we still want more providers to apply and use the portal. This morning, we had our 96th applicant, so we are getting our numbers up, and I was able to approve that provider. So if you yourself have not applied to be a provider utilizing the portal, please attempt it and try. And if you are familiar with others, please invite them to utilize it. I do think it's going to help definitely with our telemedicine patients. And again, telemedicine is the hot topic now. And this is one way that we can help facilitate utilizing technology to help our patients out. So again, use the online portal. And if you have any questions at any time with regards to how to apply, how to help the patients, please reach out. That's what we're here for. Thank you.
Thank you very much, Gary. I appreciate it. Stephanie, that is the extent of our update and presentation at this time, but we are happy to answer questions of the board members.
Thank you very much for the updates. I appreciate it. Does anyone from the board have questions for Gary or Dominic?
I had one question for Dr. French. If patients, so even if patients don't initially sign up via the website, are they able to sign up for the website so they can track their unit dosing, their units used?
Correct. A patient is not required to utilize the electronic application to use the portal. We have many patients that have applied via paper, and we do welcome them to register their email, create a password, and create their online account. And then that will facilitate them following their unit purchases. Of course, after that's done, it will be much easier for them to use the portal if they do choose to do their annual verification or recertification using it. We, of course, will always still continue to utilize paper if necessary. But, I think as we get into, this technical age here, we can help facilitate patients and make that transition because it's such a useful feature to see those purchases. So yeah, if you have had patients that have applied via paper, please feel free to invite them to register with the portal. They can use that simply for tracking their units. If they want to keep utilizing paper for applications, that would be fine as well. All right.
And then Dr. French, I have a question regarding telehealth and medical cannabis cards. I know that previously, it was necessary to have an in-person visit at least once to receive a medical cannabis card. Is that rule still active, or can people use telehealth to get medical cannabis cards now? For the record.
Great question, and I'm glad you asked it. With the advent of the Cannabis Regulation Act, that requirement from the Linen Air and Compassionate Use Act was actually done away with. So what providers can do now is you can see a patient for the first time utilizing telemedicine, and of course it needs to be audio and video, and then you can sign the patient up or certify the patient for the Medical Cannabis Advisory Program. I think back in 2007 when the Linen Air and Compassionate Use Act was passed, that they wanted that in-person requirement. But I think with COVID and just with, technology and with how hot telemedicine is that the legislature in their wisdom decided to get rid of that requirement and make it more easy for patients to get access to a provider, get access to the education that a provider can give them, and then get certified for a card. Now, as far as best practice goes, I do think that seeing a patient at least one time in person is still best practice. I mean, there's just so many things that we can get from that encounter with the patient that we can't get through a screen. But again, that option is there. And I think this will really help us reach some of those patients that are either on hospice or stuck at home or across the state in a rural area. So yes, please, that requirement's done away with. Reach out, get more patients, okay?
Thank you so much. And then I also just have a more general question for the Department of Health. Many of my patients have asked me this question and colleagues have asked me this question. I think there's some, I think the question is like, what is the Department of Health doing to ensure medical cannabis access for patients as we roll out recreational, use in the state of New Mexico?
That's a great question, Ariel. Essentially what is happening is all of the licensing through the Cannabis Regulation Act moved over to the Regulation and Licensing Department. So that includes production, manufacturing, and dispensing, of course, as well as couriers and a few other ancillary parts of the industry. So we continue to work with RLD and the Cannabis Control Division to try to ensure that they are licensing as many producers as are going to be needed, and especially licensing the number of plants. I don't have an exact number at this point yet. We are awaiting that, but it already is well in excess of the number of plants that had been licensed under the Department of Health for medical cannabis patients. And so we really do see that from a supply standpoint, that there will be, especially in the long term, that there will be more than enough cannabis for patients. And we also have been hoping with these new processes that it will also mean a lower cost for patients, that as there is more, as there essentially is more competition, or at least as there are more licensees, that then that spirit of the industry will actually help to bring prices lower for patients while still increasing the safety, testing, and other issues that are so important for patients.
And just to piggyback onto that, I think that, Dominic just mentioned that we did increase the unit limit to 425 units for patients, and that's a sizable increase. And again, this advisory board helped with that determination. And I think that increase really provides patients a lot of options as well with regards to maintaining their own access.
Excellent. Thank you. Any other questions from or comments from the advisory board? It looked like you wanted to say something, Dominic.
Yeah, I actually just wanted to share one other thing with the advisory board because I'm not sure if people know that this is there. One of the questions that we often get asked is how long is it taking to process applications? It's one of our most frequent phone calls. Our processing time right now has reduced greatly. It does vary somewhat based on the number of applications we receive in, other aspects that may be occurring, such as how many applications are coming in through electronic means, how many are coming in through paper means. And so there is some variation. But what I did want to share is that on our main web page, we actually now have, and I'm hoping everybody can see this now, we actually have a patient services application view. And so what this shows is it shows what today's date is, and it shows the dates that we are working on for data entry and the dates for the identification card print. Now, this does not, of course, include things like the mailing time. So if somebody has put their application in the mail, that's not included in here. This is from the time that we have received the application in the office. And this is a place where individuals can go to actually see the process without necessarily needing to call, especially if they've dropped off an application, so they'll know the exact date that they submitted their application. They would be able to see where the application is in process, at least from a time perspective. And so we've been actually doing this for about 6 or 8 months now. And again, this is something that we did to start ensuring that patients had access to the information about their application status. And so far, it's been received with very good feedback when we've spoken with patients on the phone. So I just wanted to make sure that the board members knew about this, and we're continuing to improve items like this on a regular basis.
And Stephanie, Tracy wanted to make a comment. So Libby, if we can unmute Tracy.
She's unmuted. Go ahead, Tracy.
Okay, can you hear me?
Yes.
Okay, I just wanted to comment that the conditions that are under medical supervision, I think that that's something that I think is a disconnect between the dispensaries and healthcare providers. I didn't know with changing, going to the recreational use, if there's going to be any more efforts to kind of combine the communication between our dispensaries and our healthcare providers in the state.
So Tracy, this is Dominic. I'm not sure what you mean as far as improving the communication. I do know that the department, we are looking at especially utilizing the website and the online patient portal to be able to communicate as much information and more information to the patients as we can. And so we're going to be doing quite a few upgrades over the next several months, as we have been doing. And we're going to continue doing that in order to be able to provide the best information we can, not just for patients, but also for providers, so that providers are able to talk with their patients quite a bit more and be able to explain the system or have resources for the patients to refer the patients to so that they can see how the process works a little bit better. I'm not sure if I'm answering your question, but does that make sense and does that help?
Yes, it does. Thank you.
And I wanted to go back to the question that Ariel had asked with regards to what is DOH doing in order to maintain access for patients. And this isn't so much what DOH is doing, but part of the CRA did require that dispensaries maintain a 20% product for patients to access. So there was some insight there with regards to having some product kept for patients so that they could access it. So.
Thanks. That's reassuring. And then also the increased quantities, I think, will help.
Excellent. Thank you.
I just want to make a comment. To Dominic, that I really appreciated those demographic numbers. I feel that's really, really interesting. I did a talk, an elective talk recently for first-year students at the UNM, at the University of New Mexico Medical School, and I actually wish I had those slides to show them, just as I think that is really fascinating. And just doing a little bit of math, I mean, it seems with 130,000 people enrolled, that's almost 10% of the adult population in New Mexico. So that's pretty considerable. So thank you very much for those numbers. Maybe I can borrow your slides at some point.
You're very welcome, JP. And yes, you are more than welcome. If you send me a reminder email, I'll send you the direct slide deck. It will be posted up on the website once we have the recording and the other information from this meeting as a part of this meeting. So it will be available there. And our plan is, in addition to doing these slides, is we actually are also doing this on our website where we are posting our monthly reports. And I'm trying to pull it up right now. The monthly report basically contains all of this information. And we are just, and let me, yes, we do have it. So let me go ahead and share it really quickly with you all. So just so you can have an idea, this is what the monthly report looks like starting in February. And again, we're going to be continuing to include the various graphic representations so that this is more, that it's more easily understandable by individuals as they are looking at it. It is public information, and so it will be available. Definitely the slide deck, as I mentioned, we'll have that available as well. And so we're also going to be continuing to add more information and more detailed information as we are able to gather that information. And part of what has happened, for example, with regard to gender, is over the years, different questions or sets of questions have been asked with regard to gender. And so we're trying to work and determine what the best way to really display and sort that data. So for example, in years past, we did not ask the newer two-part gender question. And the newer gender questions are the what gender were you assigned at birth and what gender do you identify with now? And so in years past, when that question wasn't asked, it sort of skews the data a little bit. So we have to be careful about making sure that we're representing people as they wish to be represented. And we really find that to be an important. So you will see some changes on that as we move forward. But I think that the way we've done this, we're helping to provide this information and available for presentations and things like that, because I think that is an important aspect of the education on medical cannabis and the patients that are using medical cannabis. So thank you.
Excellent. Thank you very much for the report and for the discussion from the board. I really appreciate the gender inclusion aspect that's been on the application for a while as well. So thank you very much. I appreciate that. Next item on the agenda is for the petition from the public. The petition is 2022-001 to add anxiety disorder as a qualifying diagnosis for medical cannabis. The applicants have been informed in advance that their petition will be heard today. The petition has been redacted to protect the confidentiality of the applicant. However, applicants were informed that they may speak directly to the board if they request to do so in advance. If any applicant has made such a request, the board may go into executive session to hear the individual applicant. Only those confidential issues related to the applicant's health status will be discussed in the closed session. If we do go into executive session, a separate breakout meeting will be created and board members will leave this meeting to discuss in a private, non-recorded setting. I remind those presenting petitions today that this meeting is being recorded. Before you speak, please state for the record your full name and whom you represent. All advisory board members have received copies of the petition. I ask that the presentations be kept to 3 minutes unless new information presented was not included in the original petition. If there is new information, then please limit your presentation to 10 minutes. Any petitioner who wishes to submit evidence with their petition may do so when they are recognized to present. At that time, those exhibits will be numbered and entered into the record. After each petitioner has presented, I will permit members of the board to question the petitioners. After the board has had sufficient time to discuss the petition, I will request that the board move to vote on the petition being considered, and the vote will be for approve, not approve, modify, or table. This is a little unique compared to when we have accepted petitions from the public in the past, as the petitioners for this petition 2022-001 add anxiety disorder are 2 of the board members, myself and JP. So as board members and petitioners, we are not allowed to vote on this petition as presented to the rest of the board. So after our discussion, I will take the roll call vote from the other board members. So at this time, I would like to invite JP to present the petition.
All right. Good morning, everyone. So, my background in working with patients with medical cannabis is at the New Mexico Cancer Center. So most of my patients have cancer as their primary qualifying diagnosis, but it is a symptom management clinic where I address issues of pain relief, but also one of the more frequent complaints and concerns of cancer patients is anxiety. Obviously, a diagnosis like that can cause a great deal of emotional distress. And so that's something that comes up a great deal in talking with my patients. And I felt over the last year that I've done that clinic that one of the things that the symptom that patients actually report the highest degree of efficacy for medical cannabis is with anxiety specifically. So just to break that down, the petition includes, I'm speaking of anxiety as a symptom, but in order to actually get this as a qualifying diagnosis, I included all of the anxiety diagnosis. So generalized anxiety disorder, social anxiety disorder, medication-induced anxiety, panic disorder, specific phobias, anxiety disorder due to another medical condition. That would be is one that I deal with quite a lot, unfortunately, in the cancer setting. And anxiety is incredibly common in our in the society, and I think unfortunately as physicians, we tend to minimize and discount the amount of suffering that patients experience from mental illness. And I think that as providers, we're much more likely to address patients physical pain concerns. And these, psychologic symptoms can be just as debilitating and just as painful for patients. So, looking back, I did quite a bit of research looking at the data there. Unfortunately, there's not a lot. There aren't large studies, not surprisingly, on looking at the treatment of anxiety with medical cannabis. When you do patient surveys, you see very, very high rates of self-medication amongst medical cannabis patients, and many of them finding that it does considerably help their symptoms. There was a decent sized observational study amongst medical cannabis users, which showed significant efficacy both for anxiety symptoms as well as improved sleep, which is another thing that I find patients, I think that's probably combination benefit, helping patients, reducing anxiety helps sleep, and medical cannabis has circadian rhythm in improving effects as well, which directly improve sleep. The basic medical science is all there, showing activation of the cannabinoid receptor 1 in the brain by THC. We know that has, and have known for a very long time, that has anti-anxiety effects. So while it would be great if we had more clinical studies. I mean, I think that I've gone actually through almost all the other qualifying diagnosis, and looked at the clinical research behind all the qualifying diagnosis, and many of them have less scientific background in studies than the case for anxiety disorder. So I think it's very appropriate. I think especially with mental illness, dealing with patients with mental illness. One of the things that I worry about most in starting patients on anti-anxiety treatments is the potentiality for overdose on those medications, which is just certainly heartbreaking. Cannabis, we all know, is very safe. And I think the other thing that's going to happen now that we know that patients self-medicate for anxiety. Am I getting close to my time? Am I done? Oh, well, we know that patients self-medicate for anxiety. So I think it's incredibly important now that it's going to be going rec. More and more patients are going to be self-medicating. And I think it's very important that we try and pull those patients underneath medical supervision. Thank you.
Thank you for that presentation. I really appreciated the literature review that you had also done to show some of the longitudinal studies of how helpful the cannabis is for so many patients, and that it didn't exacerbate any concerns regarding worsening anxiety. I also did a review of other states, and this would not be a new precedent, as about 5 other states have anxiety specifically listed as a qualifying diagnosis. I know that this has been a diagnosis that has been heard before this board in the past. I look forward to also working towards having this be added as a qualifying diagnosis, because I agree, I think it has been self-reported so many other times from our patients that it would be a great tool to have in addition to other treatment modalities. Not everyone responds well to SSRIs or SNRIs. There's a different way of being able to do harm reduction by reducing benzodiazepine intake. That would also be a nice tool to have. So at this time,
Question, actually, maybe for Gary. Can you, I know we've heard this before on the board, maybe even multiple times since I've been on the board for generalized anxiety disorder. Do you have the history around when we've heard it, what our recommendation was? Because I feel like we maybe have recommended it perhaps, and it was rejected by in the past. Do you have the history on it of what we've done in the past?
I don't at this moment. Let me work on that.
well, I could be wrong, but I feel like I do remember the discussions around this, and I think that we have recommended it in the past or endorsed it.
I do believe that it has been recommended in the past. I can't tell you which years. I'll have to dig that up.
I think it was under the prior administration.
I believe yes, and more recently as well. So, but I'll work on getting those exact dates for you.
Thanks. Well, either way, based on the discussions that we've had in the past, I remember this, and I would be supportive of this petition.
I think in the past, it's also been, since I've been on the board, that the anxiety disorder was not listed as an independent diagnosis. I think that it had been listed in a combination. More recently, it was listed in combination with Tourette's as well. So I think being able to have this as a single diagnosis, hopefully, and with some of the other supporting medical documentation that we have this time, hopefully we'll be able to provide a robust argument for approval from the Secretary of Health.
And to answer your question, Rachel, in 2017, it was recommended by the board. That was, I believe, the previous administration. And then 2019, as Stephanie just said, it had been connected with other diagnoses as well when it was presented and recommended by the board.
Great, thank you. So when it was connected with other diagnoses, we still recommended it, and
yeah, it was recommended by the Medical Cannabis Advisory Board,
but not approved.
But not approved. I do think that there had been a clarification that not in adolescents. I'll need to double check on that nuance to it, but it was not.
Yeah, I think this was our conversation that we had a few years back about Tourette syndrome, ADHD, and anxiety. It was kind of all bundled, and so I do think that teasing this out and having very specific anxiety diagnoses is going to reflect better on the research that we have. And I agree. I mean, you know, so many people tell me that this is helpful for them, you know, for anxiety. It's often like the primary reason that people use medical cannabis. And so we need to listen to people.
And I will add one more thing. It looks like in 2018, it had been rejected due to the inability to limit access to high content THC, which can exacerbate anxiety. So that was the response at that time.
And if I remember correctly too, a lot of patients who do have that reaction and end up having anxiety from the high doses usually self-regulate. And it doesn't take long before they are able to figure out that this doesn't work for them and they no longer engage in that medication for them.
Not only that, but, you know, I know that most of our dispensaries have bud tenders that really do know the strains very well and will guide people towards strains that are going to be more helpful for anxiety when they're walking in and saying very specifically, I need things that will help with anxiety. And so I don't, you know, just as in any medication, right? There's differences in people and their individual chemistry and how they're going to interact with that medication, and how you're going to dose that appropriately for them. It's not that different, right? Just because there's the availability of high THC strains that may exacerbate anxiety does not mean that cannabis as a whole could not be helpful to them.
I would also state that you know, as we are going towards recreational, those high THC strains are going to probably become more prevalent, and taking these people under the medical wing so that they're concomitantly using CBD, which can reduce that biphasic reaction where low and moderate doses are anxiolytic and high doses tend to be and high doses can cause increased anxiety or panic. You know, pushing them towards CBD, high CBD strains or concomitant CBD use, I think is really that's where the role of medical supervision comes in.
And not only that, but we also want to be encouraging our producers to be including these higher CBD strains and more variety in terms of what they're offering at dispensaries. And if we have anxiety disorders as an indication for medical cannabis in our state, and we have more enrollment for people for that purpose, then hopefully we then get we then actually are increasing supply of things that are not high THC strain. So great point.
I know that Tracy is on the phone. I just wanted to reach out and see if she had any comments regarding this. If she needed to be unmuted.
She's unmuted.
Thanks, Stephanie. No, I agree with the comments being made.
Excellent.
I would like to make a motion to approve the petition to recommend anxiety disorder as an approved condition.
I second that.
A second. This is
We vote no.
And I third to include all of the stated diagnoses for anxiety disorder.
I believe after the second, we need, then how do we all vote? Everyone raises their hand, but we all need to vote after that.
That's true. Yes. So it's been motioned for approval and seconded. So now I will do a roll call vote to adopt the petition. Ariel Bowers.
Yes.
Rachel Goodman.
Yes.
Ellen Plymouth.
Yes.
Tracy White.
yes.
Excellent. So of the allowed voting members in our quorum today, 4 of you, which is the majority, have approved to adopt this petition. I will be working on writing the recommendations and submitting it to the Secretary of Health, and we'll hopefully get this approved this time. Thank you all for collaboration with this. I really think that it is an important diagnosis to include as well. Excellent. Next is the public comment section of our meeting. Individuals who have pre-registered for the meeting and have requested to make a public comment will be able to comment first and should limit speaking time to 3 minutes. If you have not previously requested to make a public comment, then please click on the raised hand icon on your computer or dial #3 if you're calling in by phone. I ask for assistance from the Medical Cannabis Department with calling on the speakers and for monitoring their time. For those of you unable to make a public comment during the meeting, the public comment period will be open for 48 hours after the meeting. Please send all public comments to the following web address, medical.cannabis@state.nm.us. Thank you, and we look forward to hearing from you.
Okay, the public comment period has begun. Your name will be called and you will be unmuted. Please give your comments and then you'll be muted after your 3 minutes are finished. As Stephanie mentioned, click on the raised hand icon if you would like to speak and haven't already registered, or dial #3 if you have called in. Our first commenter is Mr. Jason Barker. Mr. Barker, I have unmuted you. You may begin.
Thank you. And thank you to the board members for allowing my public comment. I did want to point out with the question that Dr. Bauer raised about an adequate supply, state law for the Medical Cannabis Advisory Board mandates that this advisory board recommend quantities of cannabis that are necessary to constitute adequate supply. So this advisory board should have been involved with the Cannabis Control Division meetings every step of the way the last year, and that did not happen. In regards to the unit increase still allows the general public to have more buying power over the medical cannabis patients in the program. A member of the general public can go out and buy 2 ounces of cannabis, 16 grams of cannabis extract, 800 milligrams of cannabis edibles, and they can go to each dispensary all day and do this at every dispensary. I can go out in one time and buy what I'm allowed to limitly buy. So the general public has more buying power over the patients when legalization starts. Now, also, the Cannabis Control Division has actively changed dosing for the medical cannabis program. So for the cancer patients that are being treated by one of the doctors on the advisory board, you're going to have a great deal of time managing their pain when they're limited to 10 milligrams per serving of THC. And it's going to cost them a lot of money to be able to treat themselves. Now, in regards to the anxiety petitions, as acting secretary, Dr. Scrace rejected the last anxiety petition that I did. It was not bundled together. This advisory board decided that ADHD, ADD, anxiety disorder, and Tourette's would be separated and presented to him as adding individual health conditions. It was the health secretary that, well, the acting health secretary decided to bundle these together and shot them down, as well as the tobacco use disorder one you approved and the one for stimulant use disorder. Nothing in state law says that an acting health secretary is allowed to approve or deny the petitions. So there's a big legal issue right there.
You have 30 seconds.
Thank you. As far as the overall program, Americans for Safe Access, a national medical cannabis advocacy group in DC, grades all the state medical cannabis programs. We've always gotten a B grade. We got a D grade this year, and largely in part because Dr. Zerlo killed the patient's personal production license growing. So again,
time is up.
the supply
Please finish
chain.
your statement.
Thank you.
Thank you, Mr. Barker. It looks like none of the other individuals who wanted to make a public comment are on the meeting anymore. If there are other individuals who would like to make a comment, please click the raise hand icon or dial #3 if you have called in. Okay, we have Miss Jennifer Ziegler. You are unmuted, Miss Ziegler. If you would introduce yourself and you may begin your comment.
Yes, can you hear me?
Yes, we can. Thank you.
Okay, my name is Jennifer Ziegler, and I am a recipient of medical cannabis. My concern is that it is very difficult for myself to purchase medical cannabis. As Dr. or Mr. Barker said, you know, the population who's not restricted has more buying power, and when you go to the dispensaries, it's all pretty much bought up, or it could be bought up, and then it gives somebody who's disabled a more difficult chance of getting to different, well, if they're disabled, they have a more difficult chance getting to different outlets. So my proposal is that the portal that you guys coordinate be responsible, maybe have a pharmacist responsible for a cannabis pharmacy that is offered to patients. I don't know if that's possible, but that is a request of mine. So thank you very much. And thank you for all the doctors here that have participated. Thank you.
Thank you, Ms. Ziegler. Any other individuals who would like to speak? I do not show any other individuals who would like to make a public comment. Again, if you would like to make a public comment, you can do so in writing after the meeting. Can send it to our email. Thank you.
Thank you very much. It is a pleasure to participate on this board, and I appreciate all that you do in your work for patients and medical cannabis. And at this time, I would like to propose that the members of the board discuss our next Medical Cannabis Advisory Board meeting. I suggest sometime from mid-November through December 10. Tuesdays seem to work for this group. We could consider November 8, 15, skipping Thanksgiving, 29, or December 6. I motion to have an open floor discussion at this time to discuss meeting dates. Is there a second?
I'll second.
Excellent. When would you, what works for everyone to be able to have our next meeting?
I think December 6th works for me.
That works for me.
Yeah, that would be fine with me as well.
I believe I'm good with that.
Excellent. All right, so I motion to convene that the next Medical Cannabis Advisory Board meeting will take place on December 6th from 9 to noon. Is there a second?
I'll second that.
Thank you very much. It is now 10:18 on March 22nd, 2022. There is no other comment or matters of business. Then I motion that this meeting is adjourned.
Thank you very much.
Thank you.
Thank you to all the board members and people participating.
Thanks. Have a good one.